If your gums are pulling away from your teeth may look longer. But the real danger is happening underneath the surface, because receding gums are not just a cosmetic problem. They can expose the tooth root, increase sensitivity, trap bacteria, weaken the bone around your teeth, and eventually make a tooth feel loose. And here is the part most people misunderstand. Once gum tissue has physically receded, it usually does not grow back like skin after a small cut. But that does not mean you are helpless. There are 3 natural ways to protect your gums, slow the damage, and reduce the risk of losing teeth after 60. And number 3 is the one most people ignore. Even though it may be the reason their gums keep getting worse while they sleep. Let's make this very clear. Receding gums happen when the gum margin moves away from the tooth, that exposes the root surface. Unlike the crown of the tooth, the root is not protected by hard enamel. It is softer, more sensitive, and more vulnerable. That is why cold water suddenly hurts. That is why brushing may feel sharp. That is why teeth can start looking longer with age. But aging itself is not the whole story. In Dr. Robert Anderson's clinical experience, many people over 60 assume this is just getting older. Not always. Often gum recession is the result of 3 forces working together: bacteria, inflammation, and pressure. Remember those 3 words: bacteria, inflammation, pressure. Because if you control those, you give your teeth a much better chance. First, let's talk about the biggest mistake. Many people with receding gums brush harder because they think the gums are dirty. But aggressive brushing can make recession worse. Think about it. If your gum tissue is already thin and irritated, scrubbing it harder with a stiff toothbrush is like rubbing sandpaper over a healing wound. It may feel clean, but it can damage the gum edge. So the first natural protection strategy is not brushing more aggressively. It is brushing more intelligently. Use a soft bristled toothbrush or an electric toothbrush with a pressure sensor. Hold it at a gentle angle toward the gum line. Let the bristles clean the area where plaque collects, but do not saw back and forth. Small circles, light pressure, slow movement. If your toothbrush bristles are flattened after a few weeks, you are pressing too hard. That one clue tells the truth. Now here is the open loop most patients miss. If your gums bleed when brushing, that does not always mean you should stop brushing that area. Bleeding often means inflammation. Inflammation means bacteria are irritating the gum tissue. But if bleeding continues, or if there is swelling, bad breath, pus, loose teeth, or pain when chewing, that is not a natural remedy situation that needs a dental exam. Because once gum disease moves deeper, bacteria can collect under the gum line in pockets. At that stage, a normal toothbrush cannot reach the problem. This is where many people lose time. They rinse, they change toothpaste, they try home remedies. But the infection is sitting below the gum line. That brings us to strategy number 2. Reduce the bacterial load every single day. Plaque is not just food stuck on teeth. Plaque is a living bacterial film. When it stays along the gum line, the immune system reacts. Blood vessels widen, inflammatory chemicals rise. The gum tissue becomes red, tender, and swollen. Over time, chronic inflammation can damage the ligament and bone that hold the teeth in place. That is why gum disease can eventually lead to loose teeth and tooth loss. So your daily routine should target the spaces where bacteria hide. Brush twice a day, clean between the teeth once a day. But here is the key. If floss is difficult, do not quit. Switch tools, use interdental brushes, use soft picks. Use a water flosser if your dentist says it fits your situation. The goal is not to impress anyone with perfect technique. The goal is to disrupt plaque before it hardens into tartar. Because once plaque becomes tartar, you cannot brush it off at home. It has to be removed professionally, and this is where the natural conversation needs honesty. Natural care can support gum health, but it cannot scrape hardened tartar from below your gum line. If gum disease is already present, dentists commonly use deep cleaning procedures such as scaling and root planing to remove bacteria and tartar under the gums. That is not a failure. That is often the step that allows your home routine to start working again. Now stay with me, because this is where many viewers drop off and it may be the most important part of the video. If your gums are receding after 60, the mouth may not be the only problem. Your blood sugar, your medications, your immune system, and your saliva can all affect your gums. High blood sugar can make infections harder to control and can increase inflammation. Dry mouth can reduce the saliva that normally helps wash away acids and bacteria. Some blood pressure medicines, antidepressants, allergy medicines, and sleep medications may contribute to dry mouth. Less saliva means more bacterial buildup. More bacterial buildup means more gum irritation. More inflammation means more recession risk. So strategy number 3 is this: protect your gums at night. This is the dangerous mistake I mentioned earlier. Many people do everything reasonably well during the day, then spend 6 to 8 hours at night with a dry mouth, mouth breathing, acid reflux, or tooth grinding, and they wonder why their gums keep getting worse. Nighttime is when your mouth can become dry. Saliva flow naturally drops during sleep, if you sleep with your mouth open. Use certain medications, drink alcohol at night, or haven't treated sleep apnea. Dryness can become worse, and a dry mouth is a bacterial advantage. So what can you do? Drink water earlier in the evening, but avoid constantly sipping sugary or acidic drinks. Ask your dentist or physician whether any medication may be causing dry mouth. Consider a dentist-approved dry mouth rinse source Aliva substitute. If you wake up with a dry mouth, morning headaches, snoring, or choking episodes, ask about sleep apnea evaluation. And if you grind your teeth, do not ignore it. Grinding creates pressure. Pressure can stress the gumline and the bone around teeth. Over time, that mechanical force may worsen recession, especially when the gums are already inflamed. This is why a night guard can be more than a comfort device. For some people, it protects the structures holding the teeth in place. Now let's answer the question directly: can receding gums grow back naturally? In most cases, gum tissue that has already receded does not simply regenerate on its own. But early gum inflammation can improve, bleeding can reduce, swelling can calm down, bacterial load can drop, sensitivity can improve, and most importantly, progression can slow or stop when the cause is controlled. That is the real goal. Do not chase miracle regrowth. Protect the teeth you still have, because after 60, keeping your natural teeth is not just about appearance. It affects chewing, nutrition, confidence, speech, and even overall health. Here are the warning signs you should not ignore: gums bleeding regularly, teeth looking longer, bad breath that does not go away, gum pockets, loose teeth, pain when chewing, new spacing between teeth, sensitivity near the gumline. If you notice these, do not wait 6 months hoping it disappears. The earlier gum disease is treated, the more tooth support you may be able to preserve. And one more important point: be careful with online claims about regrowing gums naturally in 7 days. Healthy habits matter, nutrition matters. Vitamin C, protein, hydration, and blood sugar control all support healing. But no vitamin, oil, rinse, or homemade paste can rebuild lost gum attachment if the underlying cause is still active. You have to remove the cause. That may be plaque, it may be tartar, it may be brushing trauma, it may be grinding, it may be dry mouth, it may be uncontrolled blood sugar. The mouth is not separate from the body. Your gums are living tissue connected to your immune system, blood vessels, hormones, and metabolism. So here is the simple plan: use gentle brushing, clean between your teeth daily, control dryness and grinding at night. Get professional evaluation if bleeding, looseness, or recession is progressing. That is how you protect your teeth after 60. Not by panic, not by miracle cures, by stopping the forces that are quietly pulling the gums away. And if your gums are receding, the next thing you need to understand is loose teeth, because a loose tooth is often not a tooth problem. It is usually a support problem. And once that support starts failing, time matters.